Hi there. I'm Dr. Jennifer Sandoval, and I'm coming to you a little bit impromptu, more casual than I typically am. But I was just watching another video I posted that said I was talking about being real, and I'm like, okay, let's be real. This is me. I want to talk today about coping skills, and this will round out our um, conflict resolution series, or at least the series I've put out. So basically, I look at coping skills in two layers. The first layer is what are you doing on a day to day basis to keep your stressors at bay, or at least keep your stressors lower. So, keeping your anxiety managed, keeping your stress managed, any intense emotions, really. It could be keeping your anger managed. So, you want to think about kind of like the back layer. What are you doing on a day to day basis to keep that overall level of stress and anxiety down? Now, that will help with the second layer. The second layer of coping skills is what do you do in an acute situation? So if you're with your partner and you guys are having a discussion, things are not going well, you're going to be much better off in terms of the way you cope if you're already in the habit of taking care of yourself, going to yoga, exercising, walking with friends, spending time with friends, prayer, meditation, journal writing, guided imagery, visualization. I can go on, and maybe I'll do a video kind of breakdown of different coping skills more in depth. But those are the kinds of things that you can do on a regular basis to keep your overall level of intense emotion down. So the idea is if you're doing that, when you get into an acute situation, you're not up here already. You're hopefully down here. So it's going to take a lot more to put you over the edge. Also, if you're in an acute situation, you're in an intense conversation with your partner, you don't want to be scrambling thinking, how do I manage myself? How do I self monitor? How do I maintain a sense of balanced emotions here? It's not going to happen. So these things need to be thought through ahead of time. So, in an acute situation, however, you can do things like deep breathing. We talked about timeouts before. You can take a mini timeout where maybe you know, put your head down, you tell your partner, I just need a minute. I'm going to take a couple deep breaths and then I'm going to re-engage. Or your mini timeout, you walk to the bathroom, you splash some cold water on your face, or you call a timeout in general and you just say, look, I need a good minimum 20 minutes or an hour to get my thoughts together, to feel better emotionally, and then we can re-engage. So other things that you can do is Dr. John Gottman talks about repair attempts. So if you're in the middle of an intense conversation and things aren't going well, you can do what he calls a verbal white flag. You can say, "Hey, I'm sorry, that didn't come out right. Can I have a chance to say it again?" Or you might crack a joke. Now, careful with this one because having a sense of humor can bring the level of tension down in a conversation, but it's got to work for you and your partner. If it doesn't work for you and your partner and the timing is off, that's not something you want to do. So these are different things that you can do in an acute situation. One other thing you and your partner might say a quick prayer together, or hold hands. The other thing Dr. Gottman talks about is making physical contact. That's another type of repair attempt. So you might reach out and touch your partner's leg, or, put your hand on their shoulder, or maybe you guys just hold hands. So as I'm talking out loud, I'm thinking doing a series on coping skills would be a really good idea. So that's going to come up next. All right. If you have any questions, leave them in the comments below, and I'd love it if you could subscribe to my channel. Take care. Have a wonderful weekend. Bye-bye.